and Brad, the two most famous physical therapists on the internet.
Hi folks, I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
Together we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
Single best stretch and strengthening exercise for low back pain with stenosis.
Right.
And this is based on what you did with a real patient.
Right, exactly. And
are you the real patient?
I am, but I've done it with other real
You've
patients.
done it with other
well.
real patients too, yeah.
Now, if you want to get right to the stretches, you can fast forward a few minutes, but it's really important, I think, to understand the terms, and you're going to feel a lot better about just being diagnosed with it once you understand what it is. Otherwise, it's kind of scary.
So in other words, we're going to talk a lot before we show the exercises like we normally do. And
But
by the
it's
way,
important.
If you are new to our channel and you don't realize that's what we do, please take a second to subscribe to us. We provide videos on how to stay healthy, fit, pain-free, and we upload every day. Also, go over to the Facebook and like us, because Brad and I, as children, we're picked on, a little but bullied, and we're trying to turn things around.
Yeah.
That's a lie, by the way. So,
okay, let's
all right,
get on with the
just
show.
show your glasses real quick.
Oh, yeah.
I just think these are the coolest glasses. He's been wearing these for years. A lot of people ask about them, so we actually put them in our product list below.
Yeah, we had a lot of people comment about, oh, what are those glasses? They're great. If you need cheaters, they're the best cheater I've ever had. Then they're just wonderful.
So when they sell them, do they have like different strengths?
Oh, yeah. Those are 2.0.
Okay.
I used to have 1.5 5 years ago.
All right. Well,
you know, if you're over 45, you know how that goes.
All right. So stenosis, what is it, Brad?
Stenosis, it sounds like, oh my gosh, I got stenosis, but literally what it means is abnormal narrowing of a passage in the body. You can have stenosis in your back, you can have it in your low back, your neck, you can have it in your arteries.
Oh, sure.
So if your arteries start to clog up with plaque, that's stenosis, arterial stenosis.
And a lot of times the stenosis is really merely a product of aging.
Right.
It's like arthritis, isn't it?
Right.
Quite often. I mean, so don't be panicked. I mean, my guess is, Brad, that as you get older, there's a large percentage of people who have stenosis and probably don't have pain.
Right.
I mean, it's very, very common.
As the discs shrink up a little bit as part of the aging process when you're 50s, 60s, 70s, there's stenosis going on inherently. Just that it's not a problem.
Right.
So it's not a big deal when you see your x-rays or your MRI and they talk about stenosis on there, you know. It may or may not be an issue. So should we talk specifically what causes a problem with stenosis?
Well, which one are you talking about, spinal, or are you going to talk about the foraminal?
Well, a little bit of both, actually.
Okay.
For example, if you have stenosis, oftentimes walking becomes a problem. The longer you walk, you may have, if you have symptoms down one leg, you may have foraminal stenosis on one side. If you have both legs becoming weak and tired or numb, then you may have central stenosis.
And central stenosis, generally a lot of times they call it shopping cart syndrome.
Sure.
Because, am I jumping ahead too far?
No, go ahead. We're in tune, Bob.
All right. So a lot of times what it means is that you feel a lot better when you're bent forward a little bit.
Right.
Because when you lean on a shopping cart, you're taking some of the pressure off the back. And I see this, I mean, as soon as someone says that it's down both legs and it feels better when they lean on the shopping cart, I'm like, stenosis.
Right.
I mean, it almost always is.
And another good example, whether it's foraminal or central, is if you're working overhead, becomes painful. The pain is consistent, it goes down one or both legs, and then when you sit, feels much better.
Everything feels immediate relief.
Right.
A pretty good sign that it's. So when we say, again, Brad, I don't think we pointed this out now. So central would be. You want to grab the cups too, maybe, or not?
Yeah. Oh, well, I got to get my glasses on.
Am I too close? Lonnie has a restraining order against us, so we can only get within 10 feet of her. So that's good. So central would be right here. That's the spinal, down the spinal cord.
Right. The whole spinal cord is being impinged.
Yeah.
Foraminal is
the little holes on the side.
Right.
Yeah.
And so every vertebra you have a foraminal.
Foramen or foraminal.
Yeah. We're not going to get it.
Tomato.
Yeah, exactly.
So, and you can show the central one right on there.
Right,
so
this represents
where the spinal
vertebra.
cord goes through.
Right.
And that gets narrowed up.
Right. So when you extend or you stand or you walk, it actually pinches that main canal where the spinal cord goes through.
And when you bend forward, it kind of opens it a little
Right.
bit, so that's why, and the ligament also thickens, you know, and thins when you, did you know that? That long
Longitudinal,
ligament.
yeah.
Yeah.
We don't want to bore them with
Okay,
that.
sorry. All right, so let's get into the exercise.
The stretch.
It only took us 5 minutes.
We've only wasted 5 minutes of your time to get to the stretch. But that's the nice thing about YouTube. You can go on that little button and move it around.
So,
Okay, so now this is really a nice stretch. Anytime you do a stretch to open up that gap, so this, and you can do this, and this can help long term as well. It's just not going to feel good while you do the stretch, but it can help with other symptoms, maybe walking longer. Now this is old school, not old school. This kind of works. Just simple double knee to chest can be helpful. And if that feels good when you're doing it, this next one is probably going to feel even better. And what you need, want to get the towel roll too,
sure.
Bob?
Which one do you want?
The big one. It's right there on your right. It's right there.
Oh, yeah.
I see it. There you go. Okay.
So yeah, in this instance, we took a towel and a sheet even and rolled it all up together.
You have to roll it very tightly, okay? A roll like this, one of these rollers, soft density roller, works the best. But if you don't, have one of these yet,
You don't want to spend the money. Go ahead and roll it up and give this a try.
get one of these, and if this works, then you're going to want one of those because it's going to feel so good. You're going to put that roll not on your belt line, it's going to be below your belt line. So essentially, it's going to be on the sacrum. Maybe we can show them on the...
Sure. So the sacrum is a triangle-shaped bone right here, which is right here on me. So.
Right. So I have it on the sacrum below, and you're doing have it in the right place, because when you bring your knees up, you can just do one knee at a time, or you could do two. You're going to feel immediate relief, and it's actually going to feel good. I have stenosis. I have symptoms like we discussed, and I love this stretch.
Yeah, Brad has stenosis and spondylolisthesis.
Right.
So this possibly could work for spondy too, right, Brad?
A lot of people with spondylolisthesis do have a component of stenosis in there, just as the
way things work.
Right. Now,
So you probably want to start with one leg first, won't you, Brad?
Yes.
And,
go to one leg first, and then you can try two, and only do it if it feels better. It probably will.
So I haven't done this exercise with my patients, Brad. So has everybody tolerated it okay? I mean,
oh yeah.
Did you find anybody that said no, this just didn't
well,
work for
the
me?
problem being, if it's an older patient, is to
get in that position.
To get in that position, and you have to do it. You can't do it on your bed very well. It has to be done on a carpeted floor.
Which means you have to get on the floor, which can be problematic for some people.
That's the biggest problem as far as it not working.
Sure.
But if this does show improvement, this will work better yet. You have to get the soft one. If you get the hard one, it's not that comfortable. So the low density OPTP is one we like to use.
Yeah, we got it in our list below.
Yeah, it's the blue one.
Yeah.
Now, what I've found with this is, we're going to do the one knee, make sure you do both of them, and then this. I actually take the roller and I roll it away from me. And I'm not going to do it here on video, but I actually take my pants and I stretch it down so it goes on my skin. And I roll it away, and it gives me a stretch. It pulls on it. It even feels better, Bob. This is incredible.
So it's almost like a little traction.
It is.
So you put the roller against the skin and then push it away.
Yep, right there.
And it gives you a little traction.
I am in heaven right now, Bob. Oh, right,
literally.
You know what I mean, Bob.
Yeah, it just feels really good.
It really does. So that's the key right there. Now, for strengthening, we want to strengthen and bend the pelvis or the lumbar spine from the bottom down. So that's what this does. We're not going to flex it this way. We're going to stretch it from here down just like those do. Can you throw me the ball, Bob?
Sure.
The best strengthening exercises is to flex that lumbar spine from the hips down, which I think the best way to do it is with a ball, because it puts your back in a neutral position automatically. This takes the right size ball, a little bit of practice so you can grab a hold of it. If you do it with shorts on so your skin is touching the ball, and with a pair of shoes that the rubber edge digs into the ball, it makes a huge difference on how easy it is to get a hold of the ball. Now this, assuming if you have strong enough abdomen muscles, will feel good as well.
These are not easy though.
Right.
I'm going to say, because I just started doing these, Brad, and I'm still, you know, they're difficult to do.
But you know, if they're hard, you grab your knees here, get a hold of the ball, and then help out.
Sure.
Yeah, and this is one that'll take a little patience, a little time. But when you tighten up the muscles here and flex the lumbar spine, that's going to help open up that gap, that stenosis, and it's going to help make it more of a permanent fix, so that when you're walking, you can start to walk farther. So you want to do the stretching, and then the strengthening and the repetitions. You know, the goal initially, you can do some help, but you know, try to do up to 10. And you can assist with your hands, and then, you know, work to 10 without. And after doing these for a few weeks, you want to get to 20, 30, and up to that number if you can, because you want to get toned up for
yeah, I do
more
40.
endurance.
I do 40 of them. And,
Sure.
But I had been doing core workouts, so. But again, even though I had been doing core workouts already, I found it difficult to do. So
A smaller ball works a little bit better.
could try the Togu ball here.
Oh,
This is a tough ball. This ball.
So the smaller ball will be easier, particularly for a beginner, and you can use those for other exercises as well. So there you go. So there's 2 exercises: stretching, strengthening for that low back, stenosis, spondylolisthesis. But we haven't gotten up to the
Broken heart?
There you go.
Oh, we can fix just about anything except for a broken heart.
I caught him daydreaming.
Yeah. Thanks for watching.